Hey everybody. We are going to have class today online. We're going to give this a shot and see how it works. Oops, so bear with me. I have cartoons on the background because I have my son here puking. So I'm going to just go through the notes today and you can just follow along. You can stop, fast forward, whatever you need to do. Just make sure that you get your notes. So this is from our reading on pages 8 to 11 for chapter 1. And we're looking at determinants of health. And these are the factors that influence our health. And the Surgeon General defines them as an array of critical influences that determine the health of individuals and communities. So the government has enacted over many, many of years this plan called Healthy People. And Healthy People is a plan to basically look at the next 10 years and look at our country and come up with ways to improve the health related quality of life. So remember, that's the longer span of happy times in our life, free of pain, and also increase our total years of life, which is our life expectancy for all Americans. So a lot of your organizations related to health, not just your government agencies, will refer to the Healthy People Plan. And generally, in that plan, there's some statistics and research involved in the plan. So basically, it's just a way for all of these organizations to kind of have the same information and the same goals. So healthypeople.gov is where you want to check out to find out more. And we're going to work tomorrow in class on that. So the goals of Healthy People 2020 is to attain high quality, longer lives, free of preventable disease, disability, injury. Basically, again, looking at that health related quality of life. One other thing that they really want to push is eliminating health disparities, which we'll talk about more, and just having equity among all groups. They want to create social and physical environments that promote good health and promote a good high quality of life across all life stages. So, Healthy People 2020 has five main determinants that they focus on when they're looking at an issue. And if you watched the video on Edpuzzle, kind of explain that a little bit more and address the issue. So, when they look at one problem, they want to look at all of the five ways that they could possibly fix this or improve this area. So, the first one is individual behaviors. And four of the leading causes of chronic disease are attributed to this, which is lack of physical activity, poor nutrition, excessive alcohol consumption, and tobacco use. And I would suspect, I mean, that's from the statistics from the book coming from like 2013 and 14. I would think that with our crisis going on right now with drug use and overdoses, that would also be something that would be up there. And these are considered modifiable determinants, meaning that we individually have the power to change these. So that's in the book. You might see that again. It's good to get that jotted down because it's not one of the key vocab words, but it's in there. The second determinant is looking at biology and genetics. So, those inherited conditions and traits, disposition to diseases, other characteristics that we can't change like age, race, body structure, etc. These are typically non-modifiable determinants, meaning we don't have the power to change them. One example the book gave would be women having an increased risk of low bone density and autoimmune diseases. So gender would play a role in that, which we can't help that. The third one is social factors, and these are not just our relationships, but really even looking at the physical conditions of the environment. So things that are impacting us, like economic factors. So this kind of goes into the disparities. We'll talk more about that. But if you don't have money, if you don't have quality education, you don't have access to, you know, things like affordable utilities and medications, you're stuck in a low income job or insecure employment, those are things that are going to negatively influence your health. Also, the built environment, like what is around you. So, for example, the sidewalk improvement project that we have going on in Halifax. Will more people be walking to school? I mean, that's the plan. There's going to be a safe way to get to school. So improving the built environment by adding sidewalks and bike lanes, things like that. And then the last is pollutants and infectious agents, quality of the air, quality of our water, land, the foods, and all of that. So those are part of social factors. The fourth and fifth one, at times actually can kind of go together because there's a lot of policy involved in accessing quality health services. But the fourth one is your access to health services. And that includes not just physical, but also mental health services and health information. So the Affordable Care Act did increase the number of people with insurance, but we've seen that it also created high deductibles, which results in people delaying care because they don't want to have to pay the deductible, and therefore the diseases may not be treated until they're in the advanced stages. Policy making are basically our laws that we enact to target particular health issues when we're looking at healthcare determinants. So the indoor smoking ban, seatbelt use, helmets on bikes. We just had a new vaccination requirement this year for schools, drinking and driving rules. In fact, there's a new policy with DUI consequences that just came out about a month ago, and cell phone use while driving, and so on. So those changes, as we look at legislative changes to help the public. So what about healthcare disparities or health disparities? What is this? It is defined as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health. So basically, it's when you have groups that are not getting equal access to health or healthcare. And it could be many reasons why. Race and ethnicity can come into play, sexual orientation, gender, disability, inadequate insurance and services. Economics are a huge factor, and geographic location can also be. So some challenges of health disparities, and we definitely see this in our country. We see disparities among people of certain racial and ethnic backgrounds, and that can be for a variety of reasons. Could be because of limited education and employment due to their minority status. It could be due to even just the genetics of that racial group. Men and women also experience major differences. We see men have a higher chance of being smokers versus women. So that sets them up for higher chances of lung cancer and smoking related diseases. However, women have a higher chance of osteoporosis. And overall, men have higher rates of drug induced deaths and suicide and homicide. So men actually have a lower life expectancy than women. Your gay, lesbian, bisexual, transgender individuals may lack social support and may even be defined health benefits due to unrecognized marital status. So federal law now is changing that, but there are still things going on regarding that legally. So in some scenarios, they kind of have to fight for some of the rights. Economic status definitely influences health, especially with the ACA. You're going out and you're having to buy the healthcare, and obviously you don't have the money to buy the premium policies. You're going to have one with higher deductibles, which again goes to delaying care, or you're just going to take the fine because it's cheaper to pay the fine, and then you have no health insurance. So we still have a large amount of our population, I believe it's about 15%, that are completely uninsured. Geographic location may limit services. I mean, look at our area. We have no hospital. It may be a 20, 30-minute ride to the closest hospital. And then disabled individuals may lack services that enhance their quality of life. And many times there are services available, but it's a lot of bureaucracy to get those services, or they're not sure about the services. All right, that's it. That's our last slide for today. I will have all of the other things that you need to do on Canvas. So please check it out on the calendar.